Hi and welcome to my channel, The Massage Doctor. In my videos, I aim to teach you guys all of my techniques that I have been practicing and using for 23 years and counting. The correct amount of pressure that should be applied is very important. As you begin to apply pressure, you must ease into the muscle gently, feeling for the resistance point. Once you find the resistance, ask the patient how it feels. If the patient is okay with the pressure, then you are dialed in. I usually go past the resistance gradually for deep tissue therapy work. The key word is therapy. Therapy must have a certain degree of pain involved, a relieving pain that feels wonderful when the pressure is applied correctly. This allows a chemical called endorphins to be released. Endorphins are any of a group of secreted hormones within the brain and nervous system and having a number of physiological functions. They are peptides, which activates the body's opiate receptors, causing an analgesic effect. In brief, natural morphine. There are two ways to release endorphins. Number one is exercise, and number two is deep tissue massage. As you could see here, I'm using the base of my thumb. I like to use a count of about 5 to 10 seconds on each point that I apply pressure on. I get great results this way, and many of patients that have received my work would agree. Shiatsu is about freeing any blockages or imbalances to the key flow and rejuvenating the body by restoring energy to where it's most needed. The practice involves applying pressure to or stretching any points that lie along the lines of energy. These are referred to as meridian channels. Using thumb over thumb is a great technique that allows you to be more efficient with precision pressure and accuracy. Your thumbs will thank you for it. Here I am using the ulna bone as it is much easier on the muscle tissue. Do not use the olecranon bone, which is the sharpest point of the elbow, because it can cause great discomfort and ruin a massage session. Here I am also using the ulna bone to apply pressure on the rhomboid major and rhomboid minor, which overlaps the serratus posterior superior. Here we have thumb over thumb pressure on the supraspinatus, which is always welcome. Here I am raking across the elongated muscle fibers with my fingers. Great for relieving headaches is working on the occipitalis muscle right above the base of the occipital ridge, and the capitis muscles right below the ridge is a must. In closing, always use effleurage and tapotement strokes to end the session. I like to think of it as brushing the last of the negative energies away. If you liked the video and found it informative, please like and subscribe for more content. The support would be much appreciated.